To no ICU spaces is not the only concern for Dignity's Memorial and Mercy hospitals. They fear the surge in cases could lead to more serious circumstances.
Aaron Roney joins us now to explain how hospitals could be forced to operate if they're depleted of their resources. Aaron?
Yeah, Dave, Rochelle, the surge in cases from Thanksgiving is already taking its toll on Dignity's Mercy and Memorial hospitals, and they fear they may hit the tipping point following Christmas and New Year's celebrations. With that in mind, these healthcare facilities are pleading for people to stop gathering because if they don't, the future could look very grim.
To say it very succinctly, all of the hospitals are basically full.
Today, we are putting tents up at both campuses in anticipation of a greater surge.
The arrival of vaccines here in Kern comes as good news, but it's quickly being overshadowed by the fact that both Dignity's Mercy and Memorial hospitals are about to reach a tipping point. The surge in cases are becoming harder to control for our local hospitals, which may cause them to implement crisis care guidelines.
It is an extremely tough emotional conversation and a discernment process, and is centered on those patients given that time of crisis to make sure that we're doing the most good that we possibly can.
What it means is if the hospital runs out of their resources like medication, ventilators, or beds, they'll have to assess each patient's survivability rate.
So if you have less organ involvement, you would have a better survival rate, and at times when you have limited resources, you would want to make sure you give the resources to the most appropriate patient.
Keep in mind, this is not how the hospitals are operating now. Theoretically, if this happened, hospitals would have to go through a process like going to a peer review board and have them look into each hospital's situation and decide if following the crisis care guidance would be the best course of action. They would also need to notify local and state public health.
It's not something that we're very cavalier at all. We're very serious about it. We will not pull that trigger unless it's really just the last option for us.
Yeah, the state has discussed this option for around 6 months. Back when we saw our surge in cases over the summer, Dignity Health says they were very close to running out of medication. Reporting in studio, Aaron Roney, Eyewitness News.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.